Neurogenic shock versus spinal shock. How do you tell the difference? All right, neurogenic shock versus spinal shock. Both result from a spinal cord injury, right? But let's talk about neurogenic shock first. So most often, a higher level injury is more likely to result in neurogenic shock. Our magic number here is T6 or higher, okay? So a spinal cord injury that occurs at the level of T6 within the thoracic spine or higher. What this causes is a disruption in the information highway that is the spinal cord, right? So the spinal cord's job is to receive input from the muscles, the tissues, the periphery, and send those messages to the brain. And then the brain sends those messages back through the spinal cord down to the muscles, tissues, and periphery, okay? So when we have an injury, especially a higher level injury, there's a disruption in that message relay and in that message receiving. So what that results in is a disruption of sympathetic nervous system stimulation resulting from the level of T1 down to the level of L2. So that causes a loss of those catecholamines, those fight or flight hormones, which are epinephrine and norepinephrine. And that causes a loss of chronotropy, which increases our heart rate, and vasodilation, because epinephrine is a positive chronotrope, so it increases heart rate, and norepinephrine is a very powerful vasoconstrictor. So when we lose stimulation from those two important catecholamines, we lose heart rate and we lose blood pressure because of massive vasodilation and loss of stimulation from epinephrine. So our signs and symptoms here are going to be massive bradycardia and massive hypotension, okay? So neurogenic shock, the nervous system is in shock. The entire nervous system is in shock with bradycardia and hypotension. Our nursing assessments, we're always going to assess airway, breathing, circulation, okay? But our focus is obviously going to be on the heart rate and blood pressure because we're going to be bradycardic and hypotensive. Always we're going to take cervical spine precautions, keeping that cervical spine in alignment in any spinal cord injury. How are we going to treat neurogenic shock? Well, we have to treat the bradycardia with atropine. We have to treat the hypotension with IV fluids. And everything that we're doing is going to aim at keeping a mean arterial pressure at least 80 to 85. We always want our MAP a little bit higher than normal in spinal cord injuries to help maintain spinal perfusion. All right, so spinal shock. With spinal shock, only the spinal cord is in shock, whereas with neurogenic shock, the entire nervous system is in shock. So our patho, always there's going to be a spinal cord injury, right? So that leads to bleeding and inflammation because of the injury. That damaged tissue releases chemical mediators. Those chemical mediators happen to be very powerful, potent vasoconstrictors. And those chemical mediators cause further spinal ischemia and hypoxia. So we have restricted blood flow and oxygen to the spinal cord because of the bleeding and inflammation and those chemical mediators that cause vasoconstriction. So what will we see within the patient? Well, think about what the job of the spinal cord is. It's an information highway relaying messages from the periphery and the tissues to the brain, and from the brain down to the periphery and the tissues. So there's going to be an interruption in that. So what we're going to see is a paralysis and loss of sensation or feeling below the level of the injury. Now, the question is, will the patient's movement and sensation return? That depends on the spinal cord injury. If the spinal cord is completely transected, then no. Unfortunately, the patient's movement and sensation will not return. If it is just a matter of compression, once we're able to relieve the inflammation and the compression with steroids and things like that, then paralysis will be reversed and sensation will be restored. So it just depends on how severely the spinal cord is injured. So what will our assessments focus on? As always, we're going to maintain the airway, breathing and circulation, always cervical spine precautions, and keeping that cervical spine in alignment. But we will not have that life-threatening bradycardia and hypotension as we do in neurogenic shock. So our nursing care is going to focus a little bit differently. We're not going to have to do those life-saving medications and IV fluids if the patient is only manifesting spinal shock. So we're going to focus our care around preventing complications like pressure injuries, UTIs, and respiratory infections, which are very common in our immobilized spinal cord injury patients. And as always, we're going to optimize the patient's comfort and make sure that we control their pain. I hope you guys have found this quick review of neurogenic shock versus spinal shock helpful. Please let me know in the comments if there's anything else that you want to see, and always follow for more, and go Vols!